Blood samples for cross-match or group and save normally need to be sent with a specific request form. This should include all the normal patient identifiers, including full name, date of birth, address, hospital number and NHS number. The indication for transfusion, how many units required, and any specific requirements should be recorded. In addition to requesting clinicians' details, the person who took the blood sample should document this on the form. A pink bottle is usually used to collect the blood sample, and the patient's details must be handwritten at the bedside immediately after the blood is taken. Units of blood arrive from the blood bank in its own special insulated bag. The drug chart should accompany it so that blood bank can issue the units. Each individual unit will have an identifier label, which includes the donor unit number and donor group. This must be cross-checked with the donor unit number and donor group printed on the unit itself. Check the expiry date of the unit. Check the drug chart to ensure that the blood has been prescribed correctly. Put on an apron and some gloves. The blood giving set contains a filter, and this must be used to administer blood. You will also need a sterile swab to clean the cannula connector before connecting the giving set. Check your patient's name and date of birth verbally on the wristband and make sure it corresponds with their drug chart and the delivered unit. Protocols vary between trusts, and in some trusts you may need to double-check the unit. Check your local guidelines. Some trusts use electronic blood tracking. If so, scan your unique barcode and scan the patient's wristband and the unit. Again, make sure all the information corresponds correctly. This system electronically tracks the unit from blood bank to transfusion, improving traceability of units, reducing errors, and enhancing the audit trail. Before actually starting the unit, warn the patient that if they experience any symptoms of a transfusion reaction, they must alert the nursing staff. Protocols vary, but in general the transfusion is started slowly and the patient's observations are checked after about 15 minutes. If there are no problems, then the unit can be transfused more quickly. A maximum transfusion time is usually around 4 hours. Gently insert the giving set, being careful not to perforate the bag. Hang the unit on a drip stand. Clean the cannula connector with the sterile swab and run the blood through the giving set. Finally, attach the line to the cannula and adjust the speed. Take the label from the blood unit and stick it into the drug chart once the units have started. The lower part of the unit label is then returned to the blood bank for administration purposes.